I was having gut issues because I just didn't know what that even meant. I didn't know how to know. I think today now people are much more informed. I'm talking about like 10, 13, 15 years ago when I didn't feel it was in the zeitgeist or the conversation as much. How can someone be conscious and aware if they're not already that they may have leaky gut, that they may have gut issues that they're not fully conscious or aware of, or they're being negligent? I was one of those people who, even if there was some discomfort, I would just write it off because you're young and you're fit and you're healthy and you don't care about it too much. What should people be looking out for?
Yeah, no, that's a really good point. And once again, by the time you become symptomatic from some of this stuff, a lot of damage has already been done for a long period of time, right? And so what I look at here is another one of those biomarkers, one of those CEO of your own health type of things, which is a biomarker called HSCRP, highly sensitive C-reactive protein. This is a marker of inflammation. It's a very simple test that every doctor lab can do. We've been doing it for like 50, 60 years in medicine, but it's a marker of inflammation. You want this number as close to 0 as possible, but a lot of times it'll go up to 1, 2, 3, or 4. And usually that comes from some sort of situation going on in your gut. So your gut is the biggest organ in your body protecting you from the outside environment. Most people think it's your skin, but your gut actually has 4 or 5 times the surface area of your skin does. And so when that barrier to the outside environment is disrupted, toxins from the outside environment filter into your bloodstream, causing inflammation. Inflammation is when your immune system is overactive and you not only destroy the toxins, but you start destroying your normal brain, heart, muscle, bone cells, all of it. So you need to know when you have inflammation going on in your body. The first way to tell is by this blood test. And then probably after that blood test has been elevated for months and years, is you finally start feeling it in your gut. So if you get this measured and you have this a little bit too high, then you start need to looking at your gut as a primary source. Secondary source would be your oral health, believe it or not.
Yeah, talk about that. That's really, go for it.
Yeah, there's a huge association between poor oral health, dementia, and heart attacks as well. And that's because a lot of inflammation takes place in your mouth if you have cavities, if you have gingivitis, etc. So, if your inflammation levels are high, you need to go see the dentist, make sure your oral health is okay, but then you need to start treating your gut. Here's where a functional medicine doctor can be extremely helpful because they can really sort through what is going on with your gut. Do you have leaky gut? Why do you have leaky gut? 10% of the population has gluten sensitivities, 7% is dairy sensitive, or probably even more. These are just estimates.